If you're over 50 and waking up at night with painful leg cramps, you're not alone, and it's not just old age. The real reason behind these muscle spasms may surprise you. In fact, most people have no idea that the root of the problem often lies in a hidden nutritional deficiency. And here's the kicker: fixing it might be as simple as adjusting your diet or adding the right supplement. In this video, we'll break down the top 3 vitamins that support leg muscle strength, prevent cramping, and promote better circulation. The third one on our list is shockingly effective, and yet most doctors rarely mention it. Whether you suffer from nightly leg cramps or just want to stay active and pain-free as you age, the solutions here are clear, practical, and backed by science. You'll also learn how to spot the signs of deficiency, what foods to eat, and when it's time to seek medical guidance. So before you lose another night of sleep to muscle spasms, arm yourself with the tools to fight back. White right pointing backhand index. Don't forget to subscribe to the channel so you never miss valuable health insights, especially if you're focused on staying strong, mobile, and independent. Leg cramps become increasingly common with age, and there is a physiological reason behind it. As the body grows older, muscle mass and elasticity naturally decline. This loss of flexibility makes muscles more prone to involuntary contractions, especially during rest or at night. Reduced activity levels in older adults also contribute to muscle deconditioning, which further increases susceptibility to cramps. Another key factor is circulation. With age, blood vessels lose some of their flexibility, and circulation to the lower limbs can become less efficient. This means the muscles in the legs may not receive an adequate supply of oxygen and nutrients. Poor circulation, particularly when lying down, can trigger sudden, painful muscle spasms commonly referred to as leg cramps. The nervous system also plays a vital role. Aging can affect nerve signaling and the body's ability to regulate muscle contractions. Nerve cells may become less responsive, and slight imbalances in mineral levels can lead to misfiring of signals between the brain and muscles. This instability often results in uncontrolled spasms, especially in the calves and feet during the night. Understanding these changes is essential for prevention. What many assume to be just a part of aging is often the result of deeper biological shifts in the muscles, nerves, and circulation. Fortunately, by identifying and addressing the root causes, seniors can reduce both the frequency and intensity of these cramps. And one of the key contributors, nutrient deficiencies, one of the most overlooked causes of persistent leg cramps, especially in older adults, is the deficiency of key vitamins and minerals. These nutrients play a central role in maintaining proper muscle and nerve function. When they are lacking, even slightly, the risk of painful spasms rises significantly. The body's ability to regulate contractions, maintain hydration, and transmit nerve signals becomes impaired. Magnesium is among the most critical minerals for muscle health. It works in tandem with calcium to allow muscles to contract and then relax properly. A deficiency in magnesium can lead to frequent and prolonged cramps. Seniors are especially vulnerable, as magnesium absorption tends to decrease with age due to dietary habits and medication use. Calcium and vitamin D are equally important. Calcium enables muscles to contract, while vitamin D facilitates its absorption and supports neuromuscular control. Without enough vitamin D, calcium cannot be properly utilized, which may result in erratic muscle behavior. This is particularly concerning in older adults who spend less time outdoors or have reduced dietary intake. B vitamins, especially B6 and B12, also play a key role. They are essential for maintaining healthy nerve function and muscle coordination. A deficiency in these vitamins can lead to nerve irritation, which may manifest as tingling, weakness, or spasms. Recognizing these nutritional gaps is the first step toward restoring balance. And the best place to begin is with one mineral in particular. Magnesium is one of the most essential minerals for muscle and nerve health. It plays a vital role in regulating muscle contractions and preventing the overstimulation that leads to cramps. In essence, magnesium acts as a natural muscle relaxant. Without enough of it, muscles become more excitable and prone to spasms, especially during rest or after physical exertion. In older adults, magnesium deficiency is surprisingly common. The signs can be subtle at first: muscle twitching, leg cramps at night, fatigue, or even mood changes. As the deficiency progresses, cramps may become more frequent and intense. Several factors contribute to this, including reduced dietary intake, medications like diuretics, and diminished absorption efficiency in the gut. Dietary sources of magnesium include leafy greens like spinach, nuts, seeds, legumes, whole grains, and dark chocolate. Even mineral-rich water can provide small amounts. However, reaching optimal levels through diet alone can be challenging for seniors, particularly those with restricted eating habits. In such cases, supplementation may be necessary, but only under medical supervision. The recommended daily intake for magnesium in adults over 50 ranges from 320 to 420 milligrams per day, depending on gender and health status. When properly balanced, magnesium not only helps prevent leg cramps but also supports heart rhythm, bone strength, and blood sugar regulation. And yet, it's only the beginning. Another critical vitamin for muscle control depends heavily on sunlight and absorption. Calcium is essential for proper muscle contraction. Every movement, from standing to walking, relies on calcium being available in the right amount at the right time. However, calcium cannot function effectively without sufficient levels of vitamin D. Vitamin D enables the intestines to absorb calcium properly, and without it, calcium remains unavailable to muscles and nerves. As people age, their ability to synthesize vitamin D from sunlight decreases. This, combined with reduced outdoor activity and dietary limitations, leads to a widespread deficiency among seniors. The result: weakened muscles, poor coordination, and an increased risk of leg cramps. In more severe cases, this deficiency contributes to bone loss and heightened fall risk due to instability. Vitamin D also affects the nervous system. It helps regulate neuromuscular signaling, ensuring that muscles receive the correct commands from the brain. When levels are low, these signals become erratic, causing spasms, cramping, and fatigue. Seniors with chronic deficiencies often report nighttime cramps in the calves and thighs, especially during colder months. Sources of vitamin D include fatty fish like salmon, fortified dairy products, egg yolks, and sensible sun exposure. Calcium can be found in leafy greens, almonds, sardines, and dairy. When dietary intake isn't enough, supplements may be considered, but always under medical advice to avoid imbalances. And for complete muscle support, another mineral must join the equation. Potassium is a key mineral for maintaining electrical stability within muscle and nerve cells. It helps regulate the fluid balance inside and outside of cells, ensuring proper muscle contraction and relaxation. When potassium levels drop, even slightly, muscles may contract involuntarily, leading to leg cramps, fatigue, and weakness. This imbalance is particularly risky in seniors, especially those on diuretics or low-sodium diets. Older adults often struggle to maintain adequate potassium intake due to reduced appetite or dietary restrictions. Common signs of deficiency include muscle spasms, tingling sensations, and irregular heartbeat. To avoid this, potassium-rich foods such as bananas, sweet potatoes, avocados, spinach, and beans should be included regularly in the diet. In addition to potassium, B-complex vitamins, particularly B6 and B12, are crucial for nerve health. Vitamin B6 supports neurotransmitter production, while B12 maintains the protective sheath around nerves. A deficiency in either can disrupt nerve communication, causing misfires that result in cramps, numbness, or coordination problems. These vitamins are commonly found in animal products, whole grains, and fortified foods. However, absorption decreases with age, especially for vitamin B12, which requires adequate stomach acid to be absorbed properly. In cases of confirmed deficiency, supplementation may be necessary to restore balance and prevent further neuromuscular issues. Once these nutrients are in place, the next step is applying them through diet and smart supplementation. A well-balanced diet remains the foundation of muscle health and cramp prevention. Prioritizing nutrient-rich foods not only supports nerve and muscle function but also reduces reliance on medication. For seniors, this means including a variety of whole foods that deliver essential minerals and vitamins, particularly magnesium, calcium, potassium, and B-complex vitamins. Leafy greens like kale and spinach, nuts and seeds, legumes, bananas, avocados, and dairy products provide many of the nutrients necessary to prevent leg cramps. Fatty fish such as salmon and mackerel offer vitamin D and healthy fats, while whole grains contribute to B vitamins. Hydration is equally vital, as even mild dehydration can trigger muscle spasms. However, diet alone may not meet every need, especially in aging individuals with absorption challenges or medical conditions. In such cases, carefully chosen supplements for seniors can help bridge the gap. Magnesium glycinate, potassium citrate, calcium citrate, and methylated B-complex vitamins are among the most effective and well-tolerated options. It is essential to consult a healthcare provider before starting any supplement. Blood tests can identify specific deficiencies, allowing for targeted supplementation rather than guesswork. When integrated properly, this approach enhances overall wellness and supports stronger, more resilient muscles. But to make these efforts truly effective, movement must also be part of the equation. Regular exercise is one of the most effective ways to reduce the frequency and severity of leg cramps in older adults. Gentle movements increase blood flow, improve muscle tone, and enhance neuromuscular coordination. Over time, these benefits help prevent involuntary spasms by keeping the muscles strong, supple, and well oxygenated. Stretching is the ideal starting point. Calf stretches, hamstring stretches, and seated toe reaches can be performed daily to improve flexibility. Holding each stretch for 20 to 30 seconds encourages muscle relaxation and prevents nighttime cramps. These exercises are especially effective when done before bed, as they help release tension built up during the day. Strengthening exercises should focus on the lower body. Chair squats, leg lifts, and resistance band movements can build endurance without putting strain on joints. For those with limited mobility, even simple seated exercises improve circulation and reduce cramp triggers. Balance activities, such as standing on one foot or using a stability bar, help prevent falls and support overall leg function. Creating a safe routine starts with consistency and proper supervision. Working with a physical therapist or trained instructor ensures that exercises are appropriate for individual needs and limitations. When combined with proper nutrition and hydration, physical activity becomes a powerful defense against muscle cramps. And when those efforts aren't enough, it's time to consider the next step. While occasional leg cramps are common and often harmless, persistent or severe episodes may signal an underlying medical issue. If cramps occur frequently, interfere with sleep, or are accompanied by numbness, swelling, or skin discoloration, it is essential to consult a healthcare provider. These symptoms could point to more serious vascular or neurological conditions. One possible concern is peripheral neuropathy, nerve damage that can result from diabetes, vitamin B12 deficiency, or chronic alcohol use. Neuropathy affects the way nerves transmit signals, causing muscle misfires that resemble cramps. Left untreated, it may progress and affect balance, coordination, and mobility. Poor circulation is another potential cause. Conditions such as peripheral artery disease, PAD, reduce blood flow to the legs, depriving muscles of oxygen during exertion or rest. In such cases, cramps may occur after walking short distances or while lying down. Identifying this issue early can help prevent further vascular damage and reduce the risk of serious complications. Medications may also contribute. Diuretics, statins, and certain blood pressure drugs can deplete essential minerals like potassium and magnesium. A review of all current medications with a physician can uncover connections between treatments and cramping. When these factors are properly addressed, the path to long-term relief becomes much clearer and safer. Bullseye want to stay one step ahead of pain and mobility issues. Join our members club today for exclusive videos, early access to expert interviews, and practical tools designed for seniors who take their health seriously. You don't have to live with leg cramps. In many cases, the solution is already in your kitchen or just one conversation away with your doctor. By learning how nutrients, movement, and hydration work together, you can take back control of your body and your sleep. If this video helped you understand the causes behind your leg cramps, take a moment to act. Try the recommendations, adjust your routine, and keep track of what works. And remember, lasting change begins with small, consistent steps. Speech Balloon, leave a comment with your experience or any questions you have. Someone else might be wondering the same thing. And before you go, subscribe, hit the like button, and share this with a friend who needs it. Strong legs start with strong choices.